Wear and Care Guide Scoliosis Brace. Thank you for choosing Hanger Clinic for your care. We are here to help ease your experience by ensuring you feel comfortable and confident when navigating your scoliosis treatment. Your scoliosis brace has been custom designed to help prevent further progression of the curve in your spine as you continue to grow. Today, we will review instructions that will help you correctly use and care for your device. If at any point you have specific questions about your treatment plan, please contact your Hanger Clinic orthotist. What to expect? The primary goal of your scoliosis brace is to stop the progression of the spinal curve. For example, if you start with a 27-degree curve, the goal is to prevent the progression of the 27-degree curve over the course of treatment. Treatment will require appointments with both your spine doctor and your orthopedic surgeon and your Hanger Clinic orthotist. You will likely have more frequent visits with your orthotist to make necessary adjustments to your brace. Regular follow-up appointments with your orthotist are important to continue to assess the fit and function of your brace. Your spine doctor will determine treatment time in the brace and will determine when it is appropriate to end the treatment. Putting on your brace. Back fastening brace. Hold the brace in the front of you, spread the brace open, and apply it around your hips and torso. Move the brace up or down until it settles onto the soft spot of the waist between the hips and ribs. From the back, center the brace. Your bottom should be centered in the opening. When tightening the straps, your orthotist will confirm the order in which to tighten the brace, such as middle, bottom, top, or bottom, middle, top. Thread each strap through the opening of the metal loop and secure the Velcro back onto itself. Tension lines will be established by your orthotist for the required tightness. It may take 2 to 3 times per strap before you reach the recommended tension for each strap. Wear the orthosis to the lines marked on your straps. A loose orthosis may move and rub, causing skin irritations. The width of the opening should be centered and equal from top to bottom. Front fastening brace. If your brace opens in the front, hold the brace in front of you. Spread the brace open and apply it around your hips and torso. Move the brace up or down until it settles onto the soft spot of the waist between the hips and ribs. It is recommended that you lay on your back and tighten the straps. This allows for the recommended elongation of the spine while in the brace for the optimal spinal alignment. When tightening the straps, your orthotist will confirm the order in which to tighten the brace, such as bottom, middle, top, or middle, bottom, top. Thread each strap through the opening of the metal loop and secure the Velcro back onto itself. Tension lines will be established by your orthotist for the required tightness. It may take 2 to 3 times per strap before you reach the recommended tension of each strap. Wear the orthosis to the lines marked on your straps. A loose orthosis may move and rub, causing skin irritations. Participating in activities. When your brace is off at school, it should be stored somewhere locked or monitored, such as a gym teacher's office, athletic locker, or nurse's office to prevent it from being lost, stolen, or damaged. You may require assistance from the school nurse or gym teacher to get the back brace on and tighten to the recommended lines on the straps. If your school requires a note, please notify your orthotist. Clothing. The brace will be worn under your clothing. Loose-fitting shirts, pants, and skirts with elastic waist are most comfortable to wear over your brace. Clothing with a button and zipper may require an increase of 1 to 2 sizes. Choose the style of clothing that makes you feel most comfortable. Your orthotist will recommend wearing a tight-fitting tank top under your brace to protect your skin. Keep in mind that bras can be worn under the tank top under the brace, but underwire bras may cause discomfort. Undergarments can be worn under or over the brace. If undergarments are worn over the brace, it may make it easier to go to the restroom without removing the brace. Practice going to the restroom multiple times at home before wearing your brace to school. Recommendations and tips. Let's consider exercise to start. Wearing the scoliosis brace for gym, exercise and sports is not recommended. If participating in choir or instruments requiring deep breaths, loosen the straps for these activities or remove the brace if necessary. When eating meals, you may want to loosen the straps slightly. If needed, leave them loose for 30 minutes following your meal. For larger meals, you may remove the brace and leave it off for 30 to 45 minutes after the meal to let your food digest. The brace may remain on for snacks. As you grow, you may have to accommodate for your body changing over time. For example, as you get taller, sometimes a person will get thinner and you will feel the need to tighten your straps to prevent your brace from moving. And the opposite is also common. Should you gain weight, you may need to loosen your straps, but keep in mind, for effective treatment, your brace needs to be worn tight. When caring for your brace, do not submerge the brace in water as moisture will become trapped inside and may cause the brace to smell. Additionally, never leave your brace in a car when the outside temperature is 90 degrees or greater, as your brace can deform in a hot car. Wearing schedule. At first, your scoliosis brace may feel uncomfortable. It may feel like it is difficult to take a deep breath, and you may feel the pressures of the brace. To help ease the initial wearing of your brace, it is recommended you gradually increase the number of hours per day the brace is worn. In general, we suggest you increase use over the course of 2 weeks with the goal of being in your prescribed wearing schedule by the 3rd week. For example, you may start by wearing your brace 2 hours total on the first day, 4 hours total on the second day, 4 to 6 total hours on the 3rd day, continuing to gradually increase until you reach your recommended treatment goal. Wearing schedules are determined by your spine doctor and orthotist, keeping in mind factors including your scoliosis curve, risk of progression, skeletal maturity, and activity schedule. Your schedule will be modified to reflect your recommended treatment goal established by your spine doctor. For example, your set goal may be to wear your brace 12 to 16 hours per day versus 20 hours. Confirm your treatment goal with your orthotist. Bedtime wear. It is common to feel some slight discomfort due to the pressures applied within the brace. You can try sleeping on your side, back, or stomach. If you are unable to fall asleep after a long period, take the brace off and try again the next night. Once you can fall asleep with your brace on, you may wake up in the middle of the night. If this is the case and you do not typically wake up, remove the orthosis and continue to get a full night's sleep. After the initial 2-week break-in period, your body will begin to adjust to the new feelings of wearing a brace, and you should be able to sleep normally. Cleaning instructions. Shirts worn under the brace will absorb most of the sweat, but perspiration can collect on the foam liner over time. Make it part of your weekly routine to use a 70% isopropyl rubbing alcohol to clean the inside of the brace. Spray bottles with rubbing alcohol and washcloths work great to clean the brace quickly. Harsh cleaners such as bleach wipes are not recommended. Remember, you should never submerge your brace in water. Both you and the brace should be dry before putting it on. As you go through this journey, remember you are not alone. Scoliosis treatment is a marathon, not a sprint. It will require your commitment and tenacity for success. Scoliosis treatment success is dependent upon compliance. Compliance monitors are often placed inside the brace for objective feedback. The monitor collects data via incremental temperature readings. Monitor reports may be provided at each follow-up visit. Your orthotist will discuss the feedback from this report with you and your family. We hope you found these instructions helpful. Remember, your Hanger Clinic orthotist is available to answer your questions and support you in any way they can. If your orthotist does not hear from you, they will assume you are wearing your brace every day without issue. Please do not go days, weeks, or months without wearing your brace. It is important you wear the brace as directed by your orthotist to help prevent progression of the curve. Reach out to your Hanger Clinic orthotist with any questions. Visit hangerclinic.com/scoliosis to learn more.